Stop for a moment. What if the memory slip you laughed about this morning wasn't normal aging at all? What if the reason you walked into a room and forgot why you were there isn't simply getting older? And what if one of the 7 warning signs I'm about to reveal could appear years before a dementia diagnosis ever enters the conversation? According to health experts, millions of older adults overlook these early signals until the changes begin affecting their independence, finances, relationships, and everyday lives. Before we begin, please do one important thing. Subscribe to the channel and turn on notifications. Every week, I share practical, evidence-based health advice designed specifically for adults over 60 who want to stay mentally sharp, physically strong, and independent for as long as possible. And make sure you stay with me until the end because the 6th and 7th signs are the ones families miss most often, yet they can be among the most serious. Now let's begin. Most people believe dementia starts with severe memory loss. But that's not usually how it happens. The brain whispers long before it screams. The earliest warning signs often show up during the most ordinary moments of daily life. A forgotten conversation. A repeated question. A missed appointment. A recipe you've made for 20 years that suddenly feels confusing. Because these moments seem harmless, most people brush them aside. That's where the danger begins. The difference between normal aging and cognitive decline isn't whether you occasionally forget something. It's whether those mistakes start happening more often and begin interfering with your daily life. Imagine a quiet Sunday morning. You're sitting at your kitchen table enjoying a cup of coffee. Your daughter calls to remind you about a family lunch planned for tomorrow. You have a pleasant conversation. Everything feels perfectly normal. The next day she calls again. But this time, you have absolutely no memory of the previous conversation. None. You don't remember agreeing to lunch. You don't remember discussing plans. You don't even remember speaking with her. That brings us to sign number 1, forgetting recent information. Not memories from decades ago. Recent memories. Recent conversations. Recent appointments. Recent instructions. Many people experiencing early cognitive decline can clearly remember events from 20 or 30 years ago while struggling to recall something that happened yesterday. Because forming new memories depends heavily on a part of the brain called the hippocampus. In many forms of dementia, this area is affected very early. Here's the important thing to remember. One forgotten conversation means very little. Repeated forgotten conversations tell a very different story. One missed appointment may be completely normal. Missing appointments repeatedly is not. And one of my patients demonstrated this perfectly. Robert was 72 years old. Healthy, active, still driving, still exercising, still managing all of his finances. His family believed everything was fine. Then they started noticing something unusual. He kept asking the same questions. Not once. Not twice. Sometimes 3 or 4 times in the same afternoon. At first everyone laughed it off. Then concern began to grow. A medical evaluation eventually revealed mild cognitive impairment. Because his family acted early, Robert was able to address contributing factors including poor sleep and uncontrolled blood pressure. That early intervention made a meaningful difference in his quality of life. Which brings us to sign number 2, trouble completing familiar tasks. This warning sign often hides in plain sight. Imagine standing in your kitchen preparing breakfast. You've made the same meal hundreds of times. You know every step by heart. Yet suddenly the sequence feels confusing. You stare at the ingredients. You know what you're trying to do. But your brain struggles to organize the steps. The water is boiling. The spoon is in your hand. And for a few seconds, your mind goes completely blank. Many people describe this as feeling disconnected from a routine they once performed automatically. This isn't simply forgetfulness. It can involve something called executive function, the brain's ability to organize, plan, sequence, and complete tasks. This is where families often miss the warning signs because people become remarkably skilled at hiding them. They begin writing everything down. They avoid complicated tasks. They quietly hand responsibilities over to a spouse or family member. From the outside, everything appears normal. But behind the scenes, the brain is working much harder than before. And here's what most people never realize. Compensation can hide cognitive decline for years. Some individuals become experts at covering their symptoms, until one stressful event exposes everything. A hospitalization, an illness, the loss of a spouse, a move to a new home. Suddenly the systems they've relied on no longer work, and the changes become impossible to ignore. Now the next sign is one of the most frightening because it can affect safety very quickly. Sign number 3, confusion about time or place. Think about driving to a store you visited for years. You know the route by heart. You've made the trip hundreds of times. Then suddenly something feels wrong. The streets seem unfamiliar. You hesitate at an intersection. You know where you are, yet somehow you don't. Your confidence disappears. Your heart starts racing. You tell yourself you're tired. Maybe you are. But repeated confusion in familiar places deserves attention. Because getting lost isn't always about geography. Sometimes it's about the brain struggling to process information it once handled effortlessly. This confusion can also appear in smaller ways. Repeatedly forgetting the day of the week. Missing medications. Becoming disoriented in a familiar shopping center. Losing track of time. And while these moments may seem minor, they can quickly become dangerous. A missed medication. A forgotten stove burner. A wrong turn while driving. That's why recognizing these changes early matters so much. But here's where the story becomes even more surprising. Because the next sign often appears long before families suspect memory problems at all. Sign number 4, difficulty finding words or following conversations. Most people think dementia begins with forgetting names. But sometimes it begins with something much more subtle. Imagine sitting at a family dinner. Everyone is laughing. Stories are being shared. The conversation moves naturally from one topic to another. Yet somehow you feel like you're always one step behind. You hear the words, but it takes longer to process them. You know what you want to say, but the right word won't come. You pause. You search. The conversation moves on without you. At first, you tell yourself you're tired. But weeks later, the same thing keeps happening. This matters because language is one of the brain's most complex functions. It requires memory, attention, processing speed, hearing, and reasoning all working together. When those systems begin to struggle, conversations can become exhausting. Many people quietly withdraw from social situations because of this. Not because they dislike being around others, but because keeping up feels like hard work. And here's what most families never realize. Social withdrawal is often one of the earliest signs something deeper may be happening. If any of these signs sound familiar, type the number 1 in the comments below. You may be surprised how many people are experiencing the same thing. And stay with me because the next sign is one that can destroy financial security long before memory problems become obvious. Sign number 5. Poor judgment and unusual decisions. This is one of the most dangerous warning signs because it often looks like carelessness rather than cognitive decline. Picture someone who has always managed money carefully. They never miss payments. They read every document carefully. They question suspicious phone calls. Then suddenly they begin sending money to strangers, falling for scams, forgetting important bills, paying the same invoice twice, making decisions that seem completely out of character. One of my patients lost thousands of dollars before his family realized something was wrong. Not because he wasn't intelligent, not because he wasn't educated, but because the brain areas responsible for judgment and decision-making were quietly changing. This is why families should pay attention to unusual financial mistakes, impulsive purchases, or decisions that seem unlike the person they've known for decades. Sometimes judgment changes appear long before severe memory problems. And what comes next may surprise you even more because it doesn't look like dementia at all. Sign number 6. Changes in mood, personality, or motivation. Many people imagine dementia as a memory disease. In reality, the brain controls far more than memory. It controls emotions, motivation, personality, behavior, and sometimes those areas change first. A patient who was once calm becomes unusually irritable. A social person begins avoiding friends. Someone who loved family gatherings suddenly prefers to stay home alone. Family members often assume the person is depressed, stubborn, or simply getting older. But sometimes the brain itself is changing. Think about it this way. Imagine waking up every day feeling less confident in your own mind. Tasks that once felt easy now require effort. Conversations are harder to follow. Decisions take longer. That uncertainty creates frustration. And frustration often appears as anger, anxiety, or withdrawal. This is why compassion matters so much. Criticism rarely helps. Understanding does. The earlier families recognize these changes, the sooner they can seek answers. And now we arrive at the final sign. The one many experts consider among the most overlooked warning signs of all. Sign number 7. Problems with navigation and visual spatial skills. Most people assume vision problems come from the eyes. But many navigation problems actually begin in the brain. Imagine backing your car out of a driveway you've used for years. Suddenly the distance between your vehicle and the mailbox seems different. The angle feels wrong. You hesitate. Your confidence disappears for a moment. Or perhaps you're walking downstairs and feel strangely uncertain about where to place your feet. Maybe parking suddenly feels more difficult. Maybe familiar roads seem unfamiliar. These are not always vision problems. Sometimes they reflect changes in the brain's ability to process spatial information. And because driving, walking, and navigation are connected directly to safety, this sign deserves immediate attention. But before you panic, I want you to hear something important. These 7 signs are not a diagnosis. They are signals. Signals that deserve investigation. Many conditions can mimic dementia symptoms. Poor sleep, hearing loss, depression, medication side effects, vitamin deficiencies, thyroid problems, dehydration, high blood pressure, diabetes, sleep apnea, even untreated infections. That's why the goal is never fear. The goal is awareness. Awareness leads to action. Action leads to answers. And answers lead to better outcomes. If you've noticed repeated memory lapses, confusion, changes in judgment, mood shifts, or navigation problems, don't ignore them. Write them down. Keep a simple record. Notice patterns. Bring those observations to your doctor. Because the earlier cognitive changes are recognized, the more options you often have. And now I want to leave you with one final thought. The biggest mistake older adults make is assuming every change is simply part of aging. It isn't. Normal aging may slow you down. It should not steal your independence. It should not repeatedly disrupt daily life. It should not cause increasing confusion, dangerous mistakes, or persistent memory problems. The brain whispers before it screams. The question is whether we listen. If this video helped you, please subscribe to the channel, turn on notifications, and share it with someone you love. You could help a friend, spouse, parent, brother, sister, or neighbor recognize a warning sign before it's too late. And before you leave, tell me in the comments, which of these 7 signs surprised you the most? I read your comments every day, and your stories help others realize they are not alone. Remember, aging is inevitable, but ignoring the warning signs is optional. Protect your brain. Protect your independence. Protect the moments that matter most. I'm Dr. David, and I'll see you in the next video.